In honor of March being Red Cross Month, I decided to give back to the community and donate a pint of blood. Knowing that every 2 seconds someone in this country needs blood transfusion, it's our turn to give back. So let's donate and show how easy it really is. Now we just sit here and relax. Now, could you tell us exactly how long the blood lasts?
Well, you're giving a whole blood donation, and that means you're giving platelets, plasma, and red cells. And each one of those blood components has a different job and a different shelf life. The red cells, which make your blood red and which carries oxygen throughout your body, the red cells are good for 42 days because they can be refrigerated. The platelets are good for only 6 days because they're very fragile and they can't be refrigerated. Platelets are really important because when cancer patients are getting chemotherapy, their platelets can get, they can have very low platelet counts. And if you don't have enough platelets, you can bleed to death. So, and platelets have this very short shelf life, so we always need people to give platelets as well. Especially if you are a type AB or A, we would love for you to give platelets. If you have an O or a B, we hope that you will give as much whole blood as possible because we always need those types of red cells. And plasma can be frozen for up to a year. So, and both plasma and platelets have clotting factors in them. And that means that what you're giving today could actually help 3 different patients because rarely does a patient get transfused with whole blood. They usually get one of those 3 components because they will get exactly what their body needs, one of those 3.
Okay. All right, we're here with Candace, who's the Director of Communications here for the Southern Region of the Red Cross. First of all, thank you. And first of all, who's eligible for donating blood?
Well, you have to be at least 17 years old and weigh at least 110 pounds. And a lot of times people will assume they can't give blood because maybe they have something like diabetes or sickle cell anemia. And in fact, people with those ailments and others can give blood a lot of times. So what we ask people to do is check with us before they assume they can't give because a lot of times people self-defer when in fact they can give blood.
And how often can the person give blood?
It's safe for someone to give blood every 56 days, and that's because your red blood cells regenerate. So after 56 days, you got everything back that you gave, and it's safe to give again.
Okay, and how safe is it to give blood? I know that's a worrisome for a lot of people.
It's very safe. That is something that we take very seriously, and that is the safety of the blood donor. We want to make sure we give you a little mini exam before you can donate. We ask you all kinds of questions because we want to make sure that you're healthy, and we want to make sure that you're going to come away feeling good and that you're going to want to come back and do it again.
Okay, and then how do you prep the blood, I guess, for when you do need it for a transfusion?
Well, when we get a blood donation, first we actually take extra tubes of blood. When you give blood, you'll see that they're going to take 4 or 5 extra tubes of blood. And what they'll do is they'll take the actual blood donation you've given and they will quarantine it and send off the tubes to testing labs. And they test for all sorts of things, including hepatitis and syphilis and HIV and West Nile and other things. And they don't release the blood into the blood supply until it's come back negative. We know it's negative for all those issues, and we know it's safe to put into the blood supply. And so really, it takes about 48 to 72 hours from the time you give blood to the time it is available to hospitals.
Okay, and I know in the summertime a lot of times there's a shortage. Why is it better to donate a lot more in the summer?
Well, we get about 15% of our blood from high school and college kids. who give at blood drives at their schools. So when school's out, we are always in really bad shape. And what you'll find in the summer is, as the summer gets longer and it gets to be July and August, that we have really gotten low. And also people are on vacation and stuff like that, but it's very tough whenever kids are out of school because we get so much from them. And the other problem is we don't have enough donors in the state of Georgia. Only 3.5% of eligible donors in Georgia give blood, so we never have enough. We have to bring blood in from other states to make sure that we have enough for all of our patients. So we just need people to give more and to give more often.
All right, well, obviously we need to step up here in Atlanta, and how can we find out more information then to donate?
Well, you can call 1-800-GIVE-LIFE, or you can go to our website, which is givebloodredcross.org. That's one word, givebloodredcross.org, and you can find out about all about it. You can find out about who's eligible, who's not. You can learn about what blood is used for, why it's important, and you can also make an appointment to donate so that it's a faster experience for you. You can come in, have an appointment time, and give, and be out pretty darn fast, and you will have done something that's really important for somebody.
All right, well, thank you, and make your appointments to donate.
Thank you.
All right, well, as you can see, it's quick and painless. You really don't have any excuses not to donate. You can check out their website for more information and set up your donation time. I'm Nick Mose with Web 2.0 Television.com. Take care, Atlanta.